We've been talking about living with addiction. I'm joined now by Amy Johnston and Dr. Newhausen from United Healthcare. Amy, what is the mission of United Healthcare?
So United Healthcare's mission is to help people live healthier lives. And we know the impact that the opioid crisis has had on so many in our community, and it really goes to the heart of how we want to try to improve health outcomes for the people that we serve.
WHS 11 has appreciated also the partnership that you've forged with us in trying to help people live healthier, better lives, because we know the opioid epidemic, it's impacting everyone.
It really is, and it has been an amazing partnership over the past couple of months now to really talk about the journeys of the people we serve and introduce our community partners that we'll meet later in the segment, such as Centerstone, who's really provided those opportunities to people in the grassroots of the community.
And that treatment, which is imperative. Dr. Newhausen, paint that picture of how serious this is, not just for an epidemic here locally, but across the country.
So we know that opioids are the public health crisis of our time, that fatal drug overdoses are killing more people than car accidents, than gun violence, that we have nationally 115 people die every day from opioids. Kentucky is one of the 5 states that is hardest hit by the epidemic with the highest numbers of fatal drug overdoses. There are signs of amazing progress. Kentucky is turning the tide. Some preliminary data shows that opioid overdoses have come down due to incredible work, the leadership of the state, and the incredible work of the providers and community-based organizations on the front lines of the epidemic.
Are prescription opioids the major contributing factor, or are there others?
So prescription opioids started this epidemic, overprescribing by physicians. But now what we've seen a shift to opioids, to fentanyl really driving the epidemic, and most recently cocaine and methamphetamines are increasing and increasingly mixed with fentanyl and driving higher rates of death. So this is more than opioids. This is a comprehensive addiction crisis. It is tied to deep societal problems, and it will require a comprehensive response. And United Healthcare is here to partner with all of these frontline providers and community-based organizations and help them keep making this incredible progress.
We'll talk coming up in another segment, but is there hope for what can seem like a hopeless situation?
There's always hope, and that's one of the important messages we're trying to get out into the community.
To share that hope with our community.
Absolutely.
Okay, well, coming up, we'll talk more with Amy Johnston and Dr. Newhausen from United Healthcare.